Hi, this is J. Emmanuel Hodge, integrative medicine physician and holistic health pain specialist. Today, I'm going to show you lymphatic release for the neck, all right? Because oftentimes we have lymphatic buildup in the neck, usually under here at the jawline and anywhere around the SCM. The SCM is this muscle, sternocleidomastoid. It goes from the sternum and the clavicular up to the mastoid process. All right, that's why it's the SCM, sternocleidomastoid. Now, when we're releasing lymph, the first thing we want to do is palpate the areas to see where there's tenderness. Ask your client if between the rate of 1 and 10, where is their discomfort, pain level, tenderness level, etc. All right? They'll tell you, let's say they say a 5 or 6. All right? Then, second, you go to the lower part of the lymph area. So in the case of the neck, for the SCM, you're going down to the clavicle, but not past the clavicle. You're placing one thumb and moving that lymph firm and vigorously, all right? Moving that lymph, and then placing the other thumb and repeating the same process, okay? Now, moving the lymph from the lower areas helps make way for the lymph buildup in the higher areas to release. So, this is what we're going to do for the neck lymphatic release. All right, I'm going to have Brandy come up here and I'm going to demonstrate how you do this. Hi, Brandy. If I can have you lay face up.
Of course.
All right. A little more. Okay. Now I'm going to pan down so that we can see. There we go. All right. So, as stated, first we get the hair out of the way. All right. We can look, just to show you the SCM, this muscle right here. SCM, sternocleidomastoid. All right. Sternum, clavicular, mastoid process. Okay. Now, the way we do this is we're going to turn the head to the side, all right, which reveals the sternocleidomastoid muscle, all right? We're going to palpate the areas underneath the jaw and down the SCM, all right? Now, if you're palpating or working this SCM and you feel a pulse, okay? If you feel a pulse, that is the carotid artery. We do not want to be on the carotid artery. We want to make sure that we are not on the carotid artery as we're doing this, all right? So if we find ourselves feeling that pulse, we move posterior or move behind the SCM and work our thumb play. All right. Now, just relieving this lower part of the SCM, we will relieve any blockage in this lower part and make way for any accumulation in this higher part to release downward. And of course, we're going to go towards the heart. All right. And I forgot to ask you, on a scale of 1 to 10, based on the palpation I did, what did you feel?
I felt some tenderness in two places, here
Mm-hmm.
and then here,
Okay.
and it was probably about a 3 or 4.
So it was a 3 and a 4. All right. So we're gonna go down, and I'm pressing firmly, but not to the point where it feels like she's being choked or anything along those lines. Okay, and note, I only stayed in this area. Now I'm going to check. Do you feel any tenderness?
No.
It's gone?
Yes.
Okay, beautiful. So it's gone. Now, if she had said that, oh, it's now down to a 1, I would repeat the same process to see if it would go down completely to where there's no more sensation like it is right now. So this, when we're checking the neck lymphatics, this is what we're doing. If we're working on a older person, all right, old, loose skin, we want to be very soft, very gentle, very light with this movement. All right, but for a healthy, strong, younger person, we can be firm as we do this process, moving the thumb towards the clavicle and making sure that the client is breathing as well. All right, now also make sure that you're helping them hydrate. So I recommend after having the lymph flow and she says she feels nothing, have her hold some water in her mouth for 10, 20, 30 seconds tops, all right? Just to make sure that the lymph is flowing and it's just not moved and still stuck somewhere else. So that's the lymph for the neck, all right? Thank you.